The next procedure we'll be viewing is the canine exposure. We're working through this with the Biolase. Now the patient here has had local anesthetic applied, and I have used the needle to infiltrate around this area and using the depth of the needle to indicate the perimeter of the tooth. This is one that's obviously bulging in the palate. I use in my practice a 9000C 3D scan to determine whether there is bone or not over. But you can see through establishing a wide perimeter around the body of the crown, we're able to now pick it up with a tissue forceps, and I work through and simply just release, almost like a dissection, under light tension with the tissue forceps. I can release that flap of tissue over the top of the tooth, exposing it for the application of a bond or bracket or eyelet. What's nice about this is with the Biolase, there's not any weeping of the tissue. There's good hemostasis along the way, and you might could see from this angle that this tooth has been previously exposed, and the button or chain has been pulled from the facial aspect, and now we're going to redirect that bracket so we don't need to fenestrate the tissue. Now we're removing the last piece under light tension. We can manipulate the flap in a way so as to gain access, and this procedure is pretty much in real time. Now that tissue blanches as soon as you get off the blood supply, so it's not as easy to cut. You may require higher wattages because the pigment is again what the laser has affinity for. And there's the last piece showing now good access for cleanup and a placement of a direct bond for attachment.